I'm Dr. Sue Johnson. For the last 25 years, I have developed, researched, and taught other professionals about emotionally focused therapy for couples and families, an intervention that focuses on helping partners change how they shape their emotional responses to each other at pivotal moments in their relationship. The goal of EFT is to increase emotional accessibility and responsiveness, and so the couple's ability to create a supportive, secure, and lasting emotional bond. Emotion is the music of the dance with loved ones. We all know how powerful it is. It can change our world in a moment, instantly bring our fears and needs front and center, and signal our intentions to another with lightning speed. We show partners how to tune into their own and their lover's emotions and send clear signals that help the other person come close and respond with caring. In terms of the theoretical roots of EFT, this approach is a little like a conversation between humanistic therapists like Carl Rogers, who believed that therapy was about supporting people to grow, and systemic therapists like Sal Minuchin, who focused on restructuring the self-perpetuating feedback loops that make up a family communication relationship. Of course, John Bowlby, the father of attachment theory, joins in the conversation and reminds everyone that we're dealing with attachment bonds, relationships that our mammalian brain codes as basic to our survival, where distance and conflict are coded as danger clues, and loving connection grows and heals us, where the key relationship-defining questions are always, are you there for me? Can I count on you to come if I call, if I need? EFT is a collaborative therapy, where the therapist joins each client in unfolding their deeper emotions, fears, and needs, and taking new, more engaged steps in the dance with their partner. The first stage of therapy is all about the couple recognizing and joining to defeat their common enemy, the negative cycle that has taken over their relationship. Once cycles such as demand and withdrawal are contained, they can move forward into stage 2 and learn how to reach for each other, sharing deeper fears and needs and restructuring their bond. Then the therapist helps them consolidate the changes they have made in stage 3. If you watch an EFT therapist, you will see this person reflecting, ordering, and distilling difficult, confusing emotions, asking questions like, what's happening for you right now as your partner says this? And helping partners share their vulnerabilities with each other in ways that promote closeness and trust. The therapist teaches the couple to tune into the attachment, the bonding channel, and address issues like loneliness and recurring instances of rejection and abandonment. In a cascade of change, newly formulated experiences translate into new signals to the partner, new music that transforms how partners move together, and so the nature of the dance itself. The therapist constructs a corrective emotional experience of responsive bonding, where partners engage in what we call a hold me tight conversation. If traumatic injuries such as affairs or instances of abandonment at key moments of need block this conversation, the therapist takes the couple through a forgiveness sequence so that they can risk with each other again. Dealing as it does with the universals of wired-in emotions and attachment needs, EFT can be used with many different kinds of couples, and some of the 16 positive outcome studies involve partners struggling not just with relationship distress, but with depression and anxiety, such as the symptoms of PTSD. The strengths of EFT are: it goes to the heart of the matter. It is the only couple intervention that is based on a renowned, tested, developmental theory of love and bonding. To truly change love relationships, we have to understand the nature of love in all its urgency and complexity. We now have a science of love that allows us to do just that. This is crucial in a world where we're becoming lonelier and lonelier, and often have only one person, our mate, to depend on for emotional support. EFT is the gold standard in the field in terms of research on therapy outcome, studies on exactly how change occurs in session, positive follow-up studies that testify to long-term outcomes, and studies applying EFT to different kinds of clients and problems. Recent research shows that EFT is linked not just to increased satisfaction, but to more security in the bond between partners, and the efficacy of this bond in reducing how our brains respond to threat. EFT can help us find connection and live in the shelter of each other's support and care. This model is well articulated. The 9 steps of therapy, key change events, and interventions are outlined. Popular effective training programs, such as the 4-day externships, are offered all over the world by 30 expert trainers, and a certification process has been set out by ICEFT, the International Center for Excellence in EFT. There is a rich bank of resources, such as training tapes showing sessions of therapy. For example, EFT in Action, showing me working with a couple facing the echoes of war, came out in 2012. Recent research finds that EFT training is a rich, positive experience for trainees that enhances not just their professional expertise, but their personal lives. Our new understanding of love relationships is also laid out in a book for the public, Hold Me Tight, that clients can read and that helps them engage quickly in the EFT process. There's also a Hold Me Tight relationship education program, usually offered as a weekend retreat that therapists can offer to their clients. EFT systematically does what all effective psychotherapy does. It shows us how to regulate our emotions differently and make sense of our deepest and most significant experiences. It creates a corrective emotional experience of connection with another who can bring out the best in us, and empowers us to make active choices about who we want to be and how we want to live. We no longer have to just treat the symptoms of relationship distress. We have cracked the code of love. We can grasp how we shape the dance with our partner and the ways we make it hard for our partner to come close. We can learn to reach and evoke the tenderness we long for, heal our hurts, and repair our most precious relationships. We can shape and help others shape the treasure that man has sought all through recorded history, a nurturing, lasting love.